Good evening, everyone, and thank you for joining us this evening. I am Eric Carter, and as most of you know, I'm the CEO of the Pastoral Medical Association. I'm proud to say that the PMA has been making a difference in people's lives for about 15 years now, and we very much appreciate all of you being part of our team. The webinar today is part of PMA's commitment for 2016 to help you succeed and to grow your practice and help more families. I'm here this evening with Dr. Ryan Bentley, a medical doctor and a DC, and he is going to share the details of the virtual clinic. Ryan, if you'll flip the slide for me. Going to share the details of the virtual clinic laboratory program that is now available to you. And I think after hearing the great program that Dr. Bentley has put together, you'll be very happy you joined us today. But before I turn the program over to Dr. Bentley, let me say that, and as you probably know, the mission of the PMA has always been to restore and protect pastoral medicine, a regulated form, if you will, of natural health care with a focus on helping others improve health and recover from chronic illness. If you'll flip the slide for me, Ryan. The PMA expanded our mission in 2016 with a focus on three particularly important components of a respected and effective pastoral medicine practice. And that focus was on enhanced licensee legal protections through offering you programs that we believe will keep licensees on sound legal footing in their practices and on improved patient outcomes with, of course, a focus on overcoming chronic illness, our main mission, and, of course, a very important aspect, which is to help our licensees to increase practice income. The partnership between the PMA and Dr. Bentley and Virtual Clinics is an important part of our expanded mission. So with that said, I'll turn this over to Dr. Bentley, and again, I would like to thank everyone for being with us this evening.
All right, good
Dr.
evening.
Bentley?
Thank you very much, Eric. I appreciate that. Let me get the mute button here. Everybody can still hear me okay? Someone could type in the box, that would be great. Excellent. All right, good evening. I'm Dr. Ryan Bentley. Basically, to be honest with you, I'm a nerd. As you can see, I continue to love learning, but I love bringing what I've learned into practical aspects. I mean, gaining knowledge is great, but it's futile if you don't put it into action. And there's many things that I've learned over time as a chiropractor, as a medical doctor, and also doing research in my PhD that I've learned over time. And I want to help bring things that ultimately help the end user, which is the bottom line, the patient. And so I'm not here to give you a sales pitch, anything of that nature, because I'm a nerd. I'm not a sales guy. But bottom line is, that's it. So what I would like to do is go through the virtual clinic with you today and present it to you, let you see what the bells and whistles and tools that we have, and see if it can be implemented into your practice and help you out, and bottom line, help the patients. If I can figure out how to move my own slides. So why virtual clinic? A couple things. Importance, it's easy to use. You can order blood reports. You can monitor patient results historically with graphical representation. It's HIPAA compliant. Our vision as virtual clinic is to focus to assist clinicians in the community to capture their patients' labs in the most effective way and engage in patient interaction. And our mission is time and cost savings, value-based healthcare, and easy to maintain patient labs. The reality is we want to create an interface where doctors don't have to spend the time, too much time and repeated time to explain to the patient what is C-reactive protein. What does it mean when I have elevated anti-TPOs? What does it mean if my TSH level is high or low? What does it mean when my HDL is high or my LDL is low? And so we've really tried to take away that burden on the doctors to help them with their time and the repeatedness to with the patient. And again, it's important to educate your patients, but there are tools that can be done to help that process. And that's what we've tried to develop here, and what I think we've effectively have done. So the services that we offer is discounted blood work. And we'll go through a little bit of this throughout our time together this evening. But talking about the discounted blood work, blood reports, the graphs and historical tracking that we have available, the patient portal, the virtual clinic, and then also the data analytics that are done for you to help prioritize for you to understand what's the most priority with regards to your patients. And that is a key thing that most people don't have the ability to do when they're just getting lab reports from LabCorp or Quest or their hospital where there's no graphical representation. It's important for people to understand what is going on with their physiology, because if they understand what's going on with themselves, they can better figure out how to go down the path to get themselves better. And that's the goal of what we're really trying to do here. So again, we've got discounted blood work, blood reports, historical graphics showing the historical tracking, your patient portal, the virtual clinic, and data analytics. So you can do this entire program without any fees and still make money. You can get wholesale lab pricing that you can offer to your patients. If your state allows it, you can do an upcharge for it, whatever, and then charge for your consultations. You don't have to deal with snail mail. You don't have to deal with faxes. You don't have to wait to get a requisition form. It's a user-friendly interface, and we'll be going over that in just a moment. It's going to increase your revenue, save time, reduce your administrative burden, and ultimately give patients access to affordable health care that will give you the ability to better ascertain the information that you need without having to worry about, well, does my insurance pay for it or not, when you're able to get great wholesale lab pricing. So when it comes to virtual clinic, and we'll talk about the reports here coming up, but what is the financial potential of the virtual clinic for you? I kept this very basic and very simple. The average retail price to the patient. So when you order blood work on our portal, you pay the wholesale fee. And let's say we go with the base panel that I typically run on 90% of my patients. It's about $147. When you have that $147, just hit mute. The $147, you can mark that up for $250, $400, whatever you do. I charge $395. And then I have add-ons and things of that nature, but then also I charge $195 for my consultation. But let's just take that you don't charge your consultation fees. Let's just take the average retail price of $250 to $400. Average profit per test is going to be $120 to $270, depending upon what you charge, and if you're charging consultation fee or anything of that nature. The average profit from supplement sales per month is between $100 to $150. And in conservative figures of profit, if you look at this, $100 in supplements times 3 months is $300. A minimum of $100 profit per test. It's a $100 profit. That's $400 of profit per patient. Bottom line, by doing nothing but simply using the blood work, you can make an extra $24,000 just by having 5 patients per month of pure profit. Now, I didn't want to throw out here and say, ooh, you're going to have $1 million practice, or you're going to do that, because that's up to you. This is a tool simply for you to be able to help interface with your patients, where you become the expert in your town, and they start to look at you and they start referring more and more people to you because you have tools that no one else does. Because each person has a different practice. Each person's needs are different. But what we're providing is a simple tool for you to be able to increase your revenue into your practice. So this is just one model where it costs you nothing up front, no money at all, and you can make an extra 24 grand by 5 patients. I guarantee you have somebody, at least 5 patients per month, that needs blood work at a wholesale price. And I guarantee that's something that you can offer them. So it's very simple to register with our website. You simply go to virtualclinic.md. It's not .com, virtualclinic.md. And you go in there and you'll have the practitioner registration. You'll put your name, your clinic name, your phone number, address, and then any affiliation that you're part of. And then once you get that, you'll get your login credentials within 24 hours. When you log in, you go back to virtualclinic.md and you can hit that registration, and you come in, you hit the sign in button, enter in your email and password, and that'll let you in. When you get in, you automatically have this dashboard. Now, my dashboard looks slightly different than what people that don't pay does, because one of the key things that I have is also educational videos. So, and we'll talk about that later on. But in my portal, most people, if you're not paying, you'll have everything but the educational videos. So you'll have your profile where you can add information, and you have your patients. So simply going into the clinician's portal, you can put in there your hours of operation. People can actually schedule through this thing if you'd like for them to, because the patients will have a portal on your website if you choose to do so. But simply clinician profile, you can edit your own profile. You can edit any kind of information about your clinic, your office, anything that you want. Under my patient, and I blocked out everything for HIPAA, so we don't have patient's information revealed here. But for webinar sake, if you go into the patient portal and you go under my patients, you can simply click, add a new patient. And then when you do that, you can go in and you can, once you enter in the patient, you can always edit them. You can always edit that information on those patients. And then if you have, let's say, give you an example. So you see over here where it says private. So let's say you have 5 practitioners in your office. You all sign in under the same clinic, but you have your own individual portals. And let's say I've got 3 doctors in my office, but I really don't want them seeing my blood work. I don't want them seeing my information. Well, it automatically defaults to private. But let's say I have a patient and all 5 doctors in the office see this patient at one time or another. Then you unclick the private button and allows all doctors in that office to be able to have access to see that blood work on that patient. But if you want to hide things private only to you and only your patient, then that's something that you're able to do. When you click on the add patient, there's all kinds of information as far as getting the personal information that must be added, the contact information, and account setup. It's key that to enter in the patient's information, and when you save it, you don't have to go back and resave it. When you do typical blood work now, whenever you want to fill out a requisition, you have to keep adding in that information, handwriting it, putting it into the requisition. Once the patient is in your portal, bada bing, bada boom, it is done. You never have to enter them again unless something changes. So now let's go to my patient, Jane Smith. I view her patient profile. We can have her contact information if we want to get a quick email, look at it. But more importantly, if I want to order her blood work. And again, this is if you're not paying anything, you're just getting access to the portal. You got your My Patients, you add your patient to the portal. You go on order blood work right here. You click there. And then you're going to have a list of tests. This list is pretty extensive. It goes all the way down. There's add-on tests. There's super panels in here. If you have a panel that you want to have customized, let's say you run a certain panel no one else runs, it's unique to you, you can submit that to us. Once you register with us, you can submit it to us, and then we will submit it to LabCorp because we have about 100,000 covered lives. So we get discounts in numbers, basically. And so we're able to provide that to you, and we like to pass that savings on to you. So we have, lots of people that have covered lives that we're able to leverage with LabCorp to be able to get more volume and better pricing. So again, like I said, we pass it on to you. So you simply just would click, the add to cart button for that blood work, and then it would add it into the cart. And let's say you wanted to do some add-on testing. Let's say I think, maybe they have Fragile X syndrome, or I want to test I want to test their genotype for celiac disease to see if they got the HLA-DQ genotype. We want to check for that. We can certainly do that. Or we want to check the traditional testing of gluten, or we want to check selenium levels, or the active form of vitamin D, those types of things. You simply hit process order, and then you'll be taken here. And right here is a drop-down button because you've already added your patient. So you'll have a drop-down of all your patients. You click that, and you add that patient. Your total price will be there. You enter in your credit card information, and you hit process order. Once you hit process order, immediately the requisition form will be produced, and then you'll go right over to the requisition forms, and you'll print that off. When you print that off, we try to remove as much human error as possible. So the first thing that's going to happen is you're going to have the requisition. Doctor's got to sign it, and patient will sign it when they get their blood test. But then we also have a dear whoever your patient is. It'll give them information saying this panel requires blood work or requires an overnight fast for the blood work. You may brush your teeth and drink water. Be sure to hand the 2 forms, the requisition and the draw instructions with VirtualClinic at the top, to the technician, whether they're in your office or you're sending these patients out to LabCorp to get it drawn. And there's no fee if you use the LabCorp facilities. That's already built in with everything. And then to remove any kind of issues, we create a custom letter for every panel that is ordered. If you're just ordering add-on tests, you're not doing a panel like a super panel, then we don't include this page. But if you're ordering any of the panels, then we make sure that the proper specimens are drawn for whatever test is being done at that time. So again, like I said, we try to remove as much error as possible. Now inside the blood portal, when the blood work comes in, you'll be emailed and notified saying you have blood work available for that patient. And then you'll log in with your credentials and you'll go right over here to lab results. And then your patient's name will be listed over here, the Ascension numbers, which are the IDs. And then you click on that, and then it's going to give you your typical LabCorp report. So this is what typically everybody's going to get, but that doesn't give a lot of education to the patient. And that's where we saw the big issue coming in. So the 3 most common questions that I get from doctors and healthcare providers are this: how do I increase my profits? How do I get new patients that pay, stay, and refer? And then how do I set myself apart? And that's ultimately what the subscription does for you, as well as, just offering the blood at the wholesale prices is going to do for you. But the subscription gives you a completely different dynamic. With the subscription, when you have, and you can test run this thing without doing any kind of subscription. And there's no contracts with the subscription. It's on a per month basis. It's $197 a month, but it's on a per month basis. You can quit at any time. The subscription button is in your portal automatically, so you'll have access to be able to subscribe when you're ready. But when you do this, there's a $497 one-time setup fee. Why is that? Because we customize the product for you. Your label goes up here. Your information goes down here. So it looks like you're the genius behind all this that created this. So it doesn't bring people to us or anything of that nature. This is all about you and making you the rock star in your area, in your town. Be the one that people have the desire to go to and the one that people want to talk about. That is our goal with this entire program. So you just simply hit subscribe whenever you're ready to do it, and you're able to do so. And then you'll have access to the educational videos and then also the graphical representations of all the information available. And when you do that, under each patient, you're going to have a thing called biolabs. When you click on that, you're able to view the biolabs, where it'll have the lab results in a graphical representation, and also the section we call My Health. And then also over here on the far right, you'll also be able to just download the regular PDF from LabCorp if that's all you want to send on to other providers or whatever you want to do with it. Now, we give a graphical representation, and the way the system is built up is I wanted to do things that were prudent with regards to research and things that we can hang our hat on and things that we can be backed by research and knowledgeable information. Not running esoteric tests that have some clinical utility but really aren't backed by that. And I'm not saying that certain tests are bad, but we wanted to be able for providers, in order to gain traction and what do you want to call? I guess an authoritative notoriety that you know what the heck you're talking about in your stuff. We have to meet on some common ground. And so anything that is out of the clinical reference range is going to be in the red. Anything that is on the high end of normal or low end of normal is going to show up in the yellow. And anything that is close to the mean average within one standard deviation is going to be in the green. So that's going to be more of the optimal values. Now, I know some doctors are saying, well, the reference ranges are based off of a sick population, so the sicker that we get, the wider the reference range. And that's exactly right. But I still have to go off the reference ranges. But that is why we have the yellow section and the orange and where it blends in there, because we want to be able to pay attention to that. You can add biomarkers. Let's say you get another piece of test information, you can add that into the portal. And by the way, when the blood work comes in and you have the monthly subscription, this is automatically uploaded for you. You don't have to type in the patient's information, none of it. Your staff doesn't have to do it. It's all done by my team. Our system accommodates for all that. Your blood work is automatically imported into these graphs, but you can edit if you need to. We have a smart search button. So let's say I just want to see really quick what the homocysteine is. I type in HOM and it starts a smart search and it'll bring up anything that has HOM in it. Or if I want to bring up LDL, it's going to bring up anything that has LDL in it or all the L's that are listed. So it might be LDH. If I just type in LD, it'll bring up LDH and LDL. So you had the smart search tab for that. You also had that for your patients when you're looking for patients. We also have historical tracking. So you're able to click on the historical tracking and have a representation of what's been done over time with that patient. When you click on that, we have a couple different ways that this could be represented. When it is in the bad range, it's going to be in the red. When it is in the good range, obviously it's going to be green. And when it's in the cautionary phase, it's going to be in the yellow. And so you can look at this from a bar graph. You can also look at it as a line graph. And when you hover over this with your patients, they'll be able to see what was that value right then. And they'll also see a description of, well, what does HDL mean? We have this section in cholesterol, and it talks about cholesterol is a needed part of our on the total cholesterol section, just so you know, that cholesterol is a needed part of our physiology. It's used for cellular repair, the making of our sex hormones, and for the myelin sheath of our nerves, and also for vitamin D. However, when it's an inflamed or oxidized environment is what makes cholesterol become sticky and create the more issues in the body. So we're making it where and re-educating the patient so we understand that cholesterol is not the evil, but it is the environment in which the cholesterol is surrounded in. And so then they want to go look and see, hey, what's my C-reactive protein? Is there any signs of high levels of uric acid? Because uric acid is 50% of the body's endogenous antioxidant production. So when uric acid is elevated, uric acid being elevated is associated with heart disease. But correlation doesn't equal causation. What it simply means is the body is responding and physiologically adapting to the oxidative stress by producing more uric acid. And that oxidative stress is what's making the inflammatory response in the body, increasing the risk of heart disease. So the uric acid being elevated is a compensatory mechanism that's kind of an innocent bystander in the same way that cholesterol is as well. And then also you can have the 3D model representation. And then now the patients have access to this only to their blood work. So they'll be given a username and login as well on your site, because you'll get a widget basically, and they'll click on your website when it says go to Dr. Brown's lab portal. And it's going to give them that access to that to their own blood work. And so it's all categorized like that. It's all taken care of. Nothing that you have to deal with or you have to work with. It's all automatically done for you. So, and then also it gives some suggestions, but very basic suggestions, such as avoid smoking, increasing physical activity, increase intake of, certain fats, obviously avocado, olive oil, things of that nature. And we're always open for suggestions. So this is, again, just more demonstration of C-reactive protein in this particular case, talking to them that increase the risk of chronic diseases, but how inflammation in the acute setting is good, but it's chronic inflammation is when it becomes bad. So these are just more charts, just giving you examples. So here's one on hemoglobin A1C that did not change very much in this patient over the timeline in which we were working with. And again, as we all know, it's patient compliance in a lot of cases. But then we go to My Health Gauge. And when you click on My Health Gauge, it will prioritize. We have mathematical relationships by taking everything in the blood work that shows up in the blood work that's related to carbohydrate metabolism. And then anybody that runs the NMR with IR lipoprotein profile, which is a more advanced form of lipoprotein testing, it gives you a lipoprotein insulin resistance score. So that's categorizing this. Well, this patient, we didn't have that as an add-on. We just did a regular lipid profile on this patient. So it'll say result not available. But you can see all the things that show up in the red are here with the H's next to it. And then if you want to add this to your PDF, let's say you want to print a PDF, but you don't want to print everything with it, you have the ability to select what graphs that you want to add to your personalized report. And I'll show you this at the very end. I'm gonna show you my portal, show you a live demonstration so you can see this. But you just simply click add to print. And then if I want to check their glucose, I'm like, oh man, their glucose has been all over the place. I really need to show this to them. Bam, you click that. And you can just go through this and just show them all the things that you want to include in the report. So when they come into your office, you don't have 80 pages. You can simply show them 5 pages of the things that you think are most pertinent. We have one on immune response. So again, it's going to take the mathematical relationship of everything that is going on. What I want you to pay attention to is that we've also been mindful that there are certain things in, if you look at the ranges of lymphocytes, 18 to 48. Well, you could be on the high end or you could be on the low end. White blood cells, you could be on the high end or on the low end. So we have it represented here where it can be what I call, with my research mind, a two-tailed test for any biostats geeks out there. So we have 2 tails here, but then here we only have a single tail because, again, the reference range is from 0 to 7. So 0 is good. So the lower the number, that's okay. And that same philosophy works similarly with C-reactive protein. However, I have a few caveats in my educational videos with regards to C-reactive protein that, now I'm giving a lecture on biochemistry. I'm going to not do that to you guys. I apologize because I know I did that earlier. But nonetheless, there's lots of information showing them inflammatory processes. But it's going to categorize and it's going to populate the page with the most important ones first. And then also give them a brief explanation of what this means here. So again, simply saying long-term inflammation can be harmful and contribute to many chronic diseases. Cardiovascular disease, gallbladder health, carbohydrate. So we've shown these aspects of it. The last thing that I want to talk about that's important with regards to the panels and what you have is that in our increasing environment of, technology, we also, for the 197, so not only do you get the education and the educational videos, if you got questions, give me a call real quick. For a separate fee, people have asked me, will you just give me exactly the protocols that I want you to put my patients on because I don't want to deal with it? Yeah, absolutely. But also, if you have nurse practitioners in your office, they can simply log in and get the education and start doing a couple. And they're going to be able to just start flying through this stuff and do it for you. So people that want stuff that's done for them, that can be done. If people want me to give my advice, though, that's a separate fee that we can talk about privately offline. So VirtualClinic, one of the last things that I want to talk about is our virtual portal that we have. You have access to be able to use our telemedicine platform. We're still in the beta phases right now, so we haven't launched it fully yet. But here are some of the highlights of this. It's an integrated platform that provides telehealth. So it's like a virtual Skype that you can go back and forth with your patient. Scheduling, electronic health records, diagnostic tools, lab reports, vital signs. You can capture and annotate. Medical imaging, e-prescriptions if you're a medical physician, eliminate the geographical barriers if you're allowed to do so within the realm in which your scope of practice allows. Access to care, access to specialists, cost effective. Very simply, you can look in someone's ear. Yes, you can do that virtually. Look in someone's ear with virtual medicine with our portal. Be able to look in someone's ear and say, yes, you have an ear infection. They don't need to come in. You don't need to leave your home. Things of that nature. You can see it right there, and I'll show you that in just a second. It's HIPAA compliant and it's user friendly. So very quickly, how it's going to work with scheduling. You can have that where the patient pays up front for the initial consultation. Once it's paid, they're allowed to see your schedule that you set on your virtual consult section. And then your schedule will allow patients to be able to see when, and then they click and say submit, and then they schedule it. When they log in, you will be notified via text and email, whatever your preferences are, that you have a patient in the reception room, your virtual online waiting room. And then you log in when you're ready, and then you set this where you can have certain demographics of the patients, as far as their certain vitals that you want to have available to them, any images that you want available, and you can see the patient can see you. We've got some doctors that have used this in the beta phase where they will actually work with their patient and have they're on vacation or they're at home, and their nurse will be there, and they'll be able to utilize aspects of this and have the nurse do certain things, and the doctor just does everything that he does as if he was there. So we partnered with certain companies where you can get Bluetooth otoscopes, where you can look in the ears and be able to show, look, your tympanic membrane is perforated. You had a bad ear infection. This will heal up over time. Here's residual infection that you still have here. So you can actually show this to the patient, annotate it to them, and now it becomes part of their record. You also have a Bluetooth stethoscope that you can purchase and be able to listen to their heart and lungs virtually and be able to capture that, save it, annotate any sounds or anything if you heard a murmur or whatever, you heard rails and crackles. Again, each person's different. We got multiple platform of doctors on this and healthcare providers from all disciplines. So I'm only showing this. Some of you would be like, well, I'm never going to do that. Well, that's fine. And you don't pay for this portal. This is a pay-per-use type thing. The $197 gives you access to it. That's all I want to point out to you. So if you don't use it, great. You're not paying for it anyways. You only pay for it when you use it. And then you're able to have the, create the lab note here for this virtual medicine and virtual clinic assessment that you did with the patient, and have it all right there in one portal, and can be customized with your information on it as well. So that is a key aspect of it as well, of what we're able to offer. So you can get into this process again with no money down, just getting in, have access to the portal, have access to be able to organize your patient labs, have it right there. If you want to be able to have the graphs and the information to help educate your patients, and you have the portal on your side, that's $197. There's no limit on how many labs that you run. You can run as many as you want. It's going to be all branded with your information, and it's all going to be done for you in that process. So if you look at your return on investment, virtual clinic membership is only $197 a month. You can earn a conservative $3,700 a month. And again, that's just being very conservative. I got people that make $100,000 a month doing this stuff. There's no questions about that. You invest, $2,300, and you can bring in $44,000. And again, that's being very conservative. So that's what it's going to cost you to invest $197 a month over a year. And this is what you're going to bring in, just being very, very conservative. Again, I'm sure you've got more than 5 patients in your practice that you can do that. So bottom line is, Virtual Clinic can help you by using the tools that we have to leverage that with your patients. It's automated, it's simple, anybody can use it. You can access it anywhere, anytime, online, 24/7. Your patients have access to it if you had the subscription option as well. Again, I'm not selling any magic bullet or get-rich-quick scheme system. I'm giving you simply the tools to be able to help your patients be able to understand themselves, because the better understanding that they have, because the reality is people just don't walk in and just do exactly what the doctor says all the time anymore. Not in this era anymore. People are wanting to know more. Doctor is no longer God. We have Dr. Google. So Dr. Google can give lots of information, and we need to be able to help educate our patients in the best way possible. And that's what I've done, is gone through the scientific literature to be able to ascertain the best information, put it into language that people understand. You need the network, and this allows you to network. I didn't talk about this, but in the virtual clinic aspect here, you can, let's say I'm on here and I want to pull in Dr. K.R. Patel. Dr. K.R. Patel is double board certified. He's ER and internal medicine. Let's say I have a question on something that I don't quite understand, or I'm concerned about what I'm hearing or what I'm seeing, and I want to call them in. I can see on my dashboard who's available, and I can bring in someone as an expert consult. And then they're brought in here and they pop up right next to you. So that's something else that allows you to network with people. And those are things that I could do with people to become available for the providers that they want me to be able to work with them. You need to learn. And so it's a learning process. I got to the point, the reason why I went back and got my MD and PhD is I was already learning, I was already studying, and if I was going to continue to learn, I may as well get some extra credentials out of it. And then also, you got to have belief in yourself, believe in what you provide, and have that desire, and that's going to equal to success. And we're simply providing the tools to help you with that process. So that, in essence, is the virtual clinic in a nutshell. What I want to do is log in here and show you my lab portal. So again, you can see very quickly with this patient that her thyroid is what popped up first. So let me go right back here, and so you can see what it pops up like. So I've got 6 different reports on this patient. Again, I changed her name just for HIPAA reasons. But you can see it pops up in a very nice format, graphical. It flows out, the gauge moves there. You can see her thyroid health is the biggest concern. And it will populate paragraphs based off of what the results are showing. And so this is indicating a significant risk of hypothyroidism. You can see her anti-thyroid antibodies. And I've been working with her on this over time. So she's at 68. Well, let's look at her. She, for those of you that don't know, these are in some of my videos, but approximately 30%, 27 to 37% of patients with autoimmune thyroid have an issue with gluten. And so that led me to test this patient, and sure enough, she did. Young teenager, actually. But you can sit here and you can switch what kind of graph you want to see. You can do it in the line graph, and you can see it brings up the result. Oh, what was it then? What was it here? Well, what did we change in, between November and here? What was going on? Well, she was going off gluten. Well, guess what? So last time I tested her was, 9 months ago, and now it's starting to creep back up. Could be a lab error, but if we look at the trend, it's been going down. And then in talking with her, there was a confession that she is, again, I just ran this blood work on her, that she hasn't been as prudent as what she was once was. And also you got the 3D representation. You got different suggestions that we can put in there. And if I want to simply add that to the report, I can do so. Let's see, I'm just going to add this, and let's go ahead and do that and that. All right, and now I'm going to hit print combined. And then give me 1 second here because we'll go to see if there's questions here. There's a lot of data here. All right, so it's going to put your logo up here up at the top, your patient health report, patient's information, and then it's going to very quickly give you a breakdown of what's high and what's low in the patient, of what's out of the clinical range. So you can see that at a quick glance. And then it's going to go in and show you representation alphabetically of everything that you tested on the patient. So you'll be able to see everything there. And then also it's going to give you this imbalanced panel view, which is going to show, okay, what was her biggest issues? Again, so right here we got vitamin D need, iron need, her thyroid health was a big issue. So mathematically it's going to show you what are the biggest issues right here on this page. So you get a quick breakdown that you can see that. And again, you saw me, I added this to the panel. I wanted this to be displayed. And then also I clicked on these to be able to show the patient historically what's the trend has been. So, and you can see here. So, and it gives the results over there. Thyroid, and here's the thyroglobulin antibodies. You can see those are extremely high, and now they're extremely low. So now they're in normal range, actually. So those are things that you also have access to with the report, but again, you're able to customize it yourself. And again, it just goes down. I'll just give you an example. We got thyroid health, immune response, kidney health, red blood cell health, electrolyte balance, inflammatory processes. cardiovascular health, liver function, oxidative stress, bone health, gallbladder disease or gallbladder function, gallbladder health, carbohydrate metabolism, which is going to lead to type 2 diabetes, nutritional deficiencies. We break those out down here in a separate area. Vitamin D need, iron need, B6, calcium, B12, and folate, zinc need. And then also you can put vitals down here that would be able to create, I don't have it in here for the patients, but it will create a graphical representation of BMI over time as well. So ladies and gentlemen, that will do it for the virtual clinic on the things that I really wanted to show you. Again, I express great gratitude for you coming here. So let me go here and look at some of these questions here. Give me 1 second. Okay, so here we go. Is this only for MDs? Absolutely not. This is for all providers of healthcare. As long as you have the ability to order blood work or you've got somebody you can order under and it's within your scope and what you can do, absolutely go for it. You're able to order the blood work. It's on our account. Can I order blood work as a DC in New York? But most companies won't accept samples from New York. Thoughts? Yeah, so that's an interesting one. New York, New Hampshire, Maryland, Rhode Island, those are funny states. I've got doctors in New York that do it now, and they order with us and don't have a problem. I have one doctor that ordered, and they had a problem. The thing is that the account is set up in Indiana. What I was told from LabCorp is because our account is in Indiana, it goes under that jurisdiction. They don't allow to do test or private pay in those states. That becomes the issue. So I have the answer I can tell you is yes and no. And let's say you order it and it doesn't work for you in the lab that you're using. I can't tell you which ones are doing it, which ones that someone had a problem with. I don't know. I know one person lived pretty close to Pennsylvania, so their people just drive across a bridge and go over there. So with regards to those states, again, try it. If it doesn't work, we'll reimburse you the money right away. Not a problem. I do not accept health insurance in my practice. Is this system doable? Absolutely. This is built for basically non-health insurance people. The whole health, it's $197 a month for you. You get the wholesale pricing on the blood work, and that takes care of that aspect of that. Let's see. I do not accept health insurance either for clients that have health insurance. Is this avenue more expensive? It just depends on what people's coverage is. I tell my patients that we do not bill insurance. The blood profile I run is $2,211 worth of blood work. If you were to walk in there, that's what you would be charged, is $2,211 worth. I can't have a dual fee schedule. If I bill the insurance and they don't reimburse it, guess who gets stuck with that bill? They're like, oh, I'll pay the $395, and off we go. Do you run cardio ion test profile 2.0? If yes, how much does it cost? That is not a test that I have run. I do not know that LabCorp offers that. If they do, it's something that we will call and get discounted pricing, but I don't have anybody running that specifically right now that I know of. I've run this type of program in my practice for years. All patients pay, and it's totally doable. Thank you for that. Dr. User is all it says. It doesn't even say doctor, it says user. PMA will review and release an overview of ordering this week, which will answer these questions. PMA licensed providers have access to ordering lab tests. If you have questions, let's see here. If you have questions that are not answered during this presentation, please send them to staff@pmai.us, and they will pass it along to me. Please describe in more detail the videos that you mentioned frequently in your talk. Yes, great question that I did not cover. So if you come here under educational videos, and I'm constantly adding them as I do certain webinars, or if I'm doing a talk somewhere and it's recorded, then we often post those types of things in here. Recently, I've done some things like on hyperviscosity syndrome, sickle cell anemia, but I break down the physiology behind things. Cardiovascular disease, thyroid, gluten, number of different things. So let's say I don't really know what AST is, and I want to know what AST is. I click on the video. There's a 3-minute video of me going over the information.
Formerly known as SGOT.
Kind of go over the history of it, the breakdown of it,
such as the liver,
different things that cause it to become
pancreas,
elevated,
and that is because it is
things that cause it to be decreased, such as B6 deficiencies, because transaminase enzymes are B6 dependent. So with them being B6 dependent, they are going to show up. Right, stop talking. There we go. Let's see. All right, so we got different videos here on different blood markers, and we can add things as people request. That's not a problem for us to be able to do. All right, will your team partner practitioner provide blood analysis and nutritional recommendations to clients? You know, that like I said, we don't do that specifically for you. We let the doctors be the doctor or whoever the healthcare provider is, because we don't want to step on that. But if you want to hire somebody out, we have people in our arsenal that can be contracted out to do that for you in your practice. I'm trying to catch up. Every time someone asks a question, it moves it up or down. Do you have blood test kits like Life Extension, LabCorp? I am extremely rural Montana, 5.5 hours away from direct labs. No, but what can happen is that blood can be drawn at your office and LabCorp can come and pick it up. So that's something that we'll have to investigate and make sure that they come and pick it up, or they have a pickup site near you that may not be a draw site, but a pickup site. Will Medicare pay for these lab tests? Again, these lab tests are all cash only. You're paying us for the blood work. The patient does nothing in the portal. Patients never see your fees. They don't see any of that information. So that is fine. They can completely bill the insurance. Whatever you guys want to do on your end is fine, but we do it cash only. I recommend cash only because you get into gray areas legally by having dual fee schedules. I use functional ranges in my practice instead of lab ranges. Can they be substituted? At this time, Sue, they cannot be substituted. That is something that we're going to break out in phase 2, that if someone wants to do that, that is something that can be customized, that we can do. Currently, functional ranges do not exist in the literature, so we're not able to do that. So the best representation we have is the green and yellow, which is within the standard deviations of the norm, but we've got it set up there so it will show it on the high end and low end. And so it'll still be not necessarily great. So to answer that right now, the answer is no. Can we draw blood samples in our office and have pickup? Absolutely. Let's see. And have Eric talk on his last one here. And then how does this program work for maternity care midwife? However, if there's blood work that you want to run as a midwife, and there's certain panels that you want to run on your pregnant patients, I know there's certain things with regards to pregnancy that need to be run. That's absolutely something that you can put together. Go on labcorp.com, get the lab tests and the numbers that you want specifically, and we'll make sure that we get a panel individualized specifically for you. Eric, I'm going to, let's see. Comprehensive panel, can you please describe that a little further, including practitioner cost? I mean, honestly, guys, just sign up on the website. It doesn't cost you anything. Go to virtualclinic.md. You can go in there and see what panels we currently have that are available. And if you want to have a customized profile for you, we can get that done. Again, it takes time because we submit it to LabCorp, and then their team has to go through, and it has to go through their executive offices and all that kind of stuff. It's almost like dealing with the government, in all honesty. Last thing here. Nope, I answered that. So I'm going to unmute Eric here. And Eric, take her away, buddy.
Yes.
Eric, you're on.
I am here. Ryan, thank you for the webinar today. I see there's a lot of questions still coming in. And as I commented in the questions section, everyone, if you have questions that you haven't got the answer to, please do email either Ryan or email the PMA staff, and we will get with Ryan and make sure you get your questions answered. This recording will also be available through the PMA website. We'll send a notice out about that. If you want to rewatch or send it to a friend, that'll be available, I'm guessing, Ryan, in a couple of days here or today or...
Yeah, as soon as it's downloaded and I can figure out a way to get it sent to you, depending upon file size, we should be good to get it over to you.
Perfect. Well, we appreciate your time today, Ryan. It looked like a great program, and thank you for taking your time to show it to us today. And I think that's all I have.
Excellent. Well, thank you guys. I appreciate you. Let us know if there's anything that we can do. And again, we're open to suggestions down the line. Just get in, start using the portal, see what we have currently. And then if you're in there, we'll start moving forward and go from there. So take care, guys. God bless, and I wish you well.